So the temperature is actually quite low. So I think it's interesting to see, so the lining of the airway itself doesn't get burned. So it's actually not that hot. It's not like a burn. It's basically low enough to deliver thermal energy through the airway wall, and then it's just targeting the airway smooth muscle. So if you go back in and look at it, it's not like that airway scarred or inflamed, at least at the time of the procedure.
Is it edematous, a day or two later?
Yeah, so there are some patients, so there is going to be some inflammation that happens due to the procedure. And so when looking at the sort of side effects of the therapy, most people tolerate it really well. Long-term side effects are very low, but short-term side effects from what you're describing are fairly common. So airway irritation can happen in some patients, typically not immediately because there's not an immediate burn, but there is inflammation at the site. And this can lead to sort of a short-term increase in coughing, wheezing, some increased mucus production, and there was a slight increase in hospitalization rate after the procedure due to some of that inflammation. But more long-term safety therapy has been very promising. So the studies that have looked at this have really shown improvement in quality of life, reduced exacerbations, and improvement in ER visits. There's less clear-cut data in regards to spirometric changes, and there's a lot of limiting factors. So this is definitely an emerging therapy. One of the limiting factors is cost. This is an expensive procedure, anywhere between $10,000 and $20,000. It depends on where you're getting it. There is providers in Oklahoma that do it. Over at the university, they have started doing bronchial thermoplasty, but the need for more skilled providers is important, and there are other groups out looking into it throughout Oklahoma. So I think one of the big points that need to be understood with bronchial thermoplasty is it's a really exciting, innovative, non-medicine way of treating patients with asthma. But it's going to be really important when we go back to this endotyping asthma to really try to identify those patients whose airway smooth muscle plays the most prominent role in their asthma symptoms, so we can target this really expensive therapy for those that would benefit from it the most. And at least at this point, it's not entirely understood who is the best group of patients to do it.